Everyone, this is Dr. Schroeder with this week's video introduction to week number 3 of our course in healthcare research. And week number 2, the primary topic was discussing the differences between primary and secondary sources of information, which I think everybody did a pretty good job with that. I don't think that there was too much confusion in class along those lines at all. Primary source is essentially anytime you have a study where there's the article or the research study that's being presented. The central focus of that particular article is the study that's completed. That's considered a primary source of information. As much as possible, we always want to go to primary sources. A secondary source is where, for example, in a textbook, where a textbook talks about a study or a textbook talks about another source. In other words, you have a source that is appropriate, but it cites another source within that particular source. That is considered a secondary source. Secondary sources are appropriate as well. And later on, we'll be talking about how we assess the number of primary and secondary sources. How many primary sources did a researcher use when they developed and planned their study? Not all sources need to be primary sources, but there should be a preponderance, or there should be a majority of the sources that are cited within a study should be primary, and the researcher should always be referring to those as much as possible. We also talked about the differences in wording of research questions between a qualitative and quantitative study. And as I mentioned, I believe last week in my introduction, and as I brought in the discussions this week, talked about whenever you have a research question that asks for correlation or seeks to look at a cause and effect, when you have that kind of a research question, it should always be a quantitative study. In other words, it's not the subjectivity necessarily, or the subjective nature of a study that determines whether it's a qualitative or quantitative study. It's not the topic, in other words. It is, what is the research question? What does the question seek to understand? And then if you have a research question where that usually starts, most qualitative research starts with the terms little is known about, or little research has been conducted on a particular phenomenon, or nobody has really looked at what are the values, attitudes, and beliefs of a particular population over a particular situation. When you have a research question that is written like that, that's a qualitative study. That's a qualitative research question. And we'll be continuing that discussion a little bit more this week in week number 3, where we talk about, again, with our two articles here, the Beck study and the Kokava study. We'll talk about, did the authors do a good job of showing that there's a significance to nursing for their study? One thing I want to point out is that it's not necessarily required for a researcher to explicitly state what the significance is, but it needs to be described in some way. And so for both of these studies, is it significant? Is there a significance to nursing for both of these studies? And then we're going to talk about hypotheses, and was there a hypothesis in each one of these studies? And if there wasn't a hypothesis, was that appropriate? And why or why not? So that's going to be the focus of this week. I will once again be participating along with you in the discussion questions. As you have any questions, please feel free to let me know. I will address any of the questions that come up. And as we start to get into especially some of these terms and concepts related to validity, as we go into week 3 and week 4, let me know, and I'll be happy to more than happy to explain those either here in the weekly video or in the discussion questions themselves. So fairly straightforward this week. I will have your grading by the end of the week. As you have any questions, please feel free to let me know, and I look forward to seeing you in the discussion forums.